Hi everyone, this is Shibi from Teachers Academy. Welcome to another video. Today, I am here to discuss a few tips on speaking subtest. You all know that OIT we have role play cards. So today I am discussing about the importance of using good questions during OIT role play card. Why should we ask good questions during OIT speaking subtest? We should ask good questions because first of all it's a conversation. So in order to make it very interesting, you should ask questions. Secondly, in order to make the conversation more engaging, you should ask good questions. Another thing is that to have a better understanding of the patient's condition and to discuss the diagnosis and treatment well with the patient, you need to have good questions. If you ask good questions, you will get good answers and it will help you to do the role play card very well. Now let's discuss about the type of questions that can be asked in OIT role play cards. The first type of questions that we normally ask are close-ended questions. So you know very well about close-ended questions. They are questions in which we will get answer as yes or no. For example, do you have chest pain? Do you experience any pain? Do you feel bad now? Likewise. So these questions we will get only one word answer and they are only yes or no. If you ask close-ended question, there is no room for explanation from the part of the patient. So you won't be getting the required details that you need in order to complete the conversation. So it is better to avoid close-ended questions throughout the role play card, but you can ask as a beginning or when you take some information from the patient, you can ask close-ended questions. Now the next type of questions are open-ended questions. They are the most effective question and it will be the best strategy to use open-ended questions in your conversation. What are open-ended questions? Open-ended questions are the type of questions where the patient has to explain in detail about their feelings or the kind of condition they are having. For example, how long have you been experiencing this? Or how much alcohol do you drink? Likewise. In these questions, the patient has to explain that the kind of habit they are having or they'll have to describe about the feelings they have. So it's always better to ask open-ended questions in a conversation. The next type of questions that we commonly use in OIT role play are encouraging questions. For example, if the patient is reluctant, then you can ask questions like, can you please say more about it? Can you talk more about that? If you say so, the patient will be encouraged to talk more about something that they do not like to talk. The last kind of questions that you can ask is the questions that will help you to check the understanding of the patient. For example, is that okay? How does that sound? Did I make everything clear to you? These questions will help you whether the patient is listening to you or the patient is attentive. So these are the kind of questions that will be helping you when you are practicing your OIT role play speaking cards. So please make use of the questions and get a B score the next time you appear for OIT speaking subtest. Thank you.